My name is Dr. Kannan Athreya. I'm a private GP based in Brentwood, Essex. I became a GP quite some time ago, in 1995, so coming up to 30 years experience. I spent the first 18 years in NHS general practice, but I dabbled in the private sector and then moved across completely in 2014, founding my own clinic at that stage, and then now I work with another company in the same Brentwood area. Interesting question. Sometimes I do think what motivated me to do this. I think in likelihood I was greatly influenced by my father, who wanted to be a doctor himself, but didn't have the opportunities. He tried to get his siblings involved, and then my older sister, and finally it fell on my shoulders. Did I do it for him to be proud of me? I probably did, but it was the best thing I ever did. I think it's the perfect job for someone like me, and it's been the privilege of my life. I was initially interested in looking into aspects of general surgery, but I moved across from that quite quickly, purely because I didn't feel that my particular skills were involved in just spending long days in operating rooms. I'm much more of a people person. In addition, being a general practitioner allowed you to have a wide range of skills and to dabble in all sorts of different areas where you may have an interest. And that's proved to be a very good decision. I do a lot of minor surgery, which fulfills that need to operate a blade, but also I've got involved in all sorts of different therapies and management skills, things I would not have done in a narrow speciality. So there's a lot of variety in my work, and I'm very pleased that I made this choice. I think in retrospect, being at this job for so long, what I've noticed is the number of people who, for them, I've been their only doctor. Being a general practitioner in the same area for over 30 years does mean that I've looked after people throughout their own childhood and young adults, and now they have their own children who they're bringing across to me. Also, knowing many people in the same family and knowing that they talk amongst each other and they're happy with the work that I do, has been exceptionally rewarding. And clearly it's something that I feel that when someday perhaps I'm not a general practitioner anymore, is I'll look back on and think it's, again, been a fabulous privilege. Well, I would like to think that I'm very open, I'm friendly, I'm very approachable. I do genuinely care about my patients, and I think it's reflected in the way I practice and in the following that I have amongst the people that I've been looking after for so many years. I do get feedback from my patients that are very positive, but actually without having any formal feedback, I know that the warmth of my consultations with them and the realization that I've reduced their stress and anxiety in some way by being able to help them towards their health goals has been a very gratifying thing for me.